Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions for the OET candidates and we have with us Kiran, Kaur from Delhi, India. Yes, Kiran, once you are ready, you can start.
Yes, sir, I'm ready. So I can start, sir?
Yes, of course.
Okay. So how can I address you during this conversation?
You can call me Mrs. Lincoln or Martha.
Martha.
And my daughter's name is Elizabeth.
Elizabeth. So good morning, Martha. Good evening,
morning,
Martha.
nurse.
Yeah, my name is Kiran. I am one of registered nurse working in this emergency department. So I have got your daughter Elizabeth notes. I can understand that you are brought your daughter in the emergency department because she had a chest tightness, wheezing, and breathlessness. Is it right?
Yeah, of course, nurse.
Yeah. So I have evaluated her condition in the triage, and I have just taken her vital signs. Now she is stable now. But before further proceeding, I need some more information regarding your child symptoms. So may I please?
Yeah, please, of course. My daughter has been brought to the emergency department because she has chest tightness, wheezing, and difficulty breathing. And yeah, of course, she was playing in the garden, So it started then, and I don't know what happened exactly. And that time it was very serious, but now she's okay, little comfortable.
Okay, fine. So I need some more information regarding her symptoms. So may I please?
Yes, please, nurse.
Yeah. So could you please tell me, have you noticed the duration of symptoms or any particular situation that trigger her symptoms, or have you noticed any? Yeah.
Yeah,
Okay.
of course. The symptoms were there for almost an hour.
Yeah.
And yeah, wheezing and
Okay.
difficulty breathing was there for almost an hour. She was running around in the
Okay.
garden and she started
Yeah.
having difficulty breathing. Now the symptoms are
Fine.
less severe when they started. I haven't given her any medications because I wasn't sure what to give her. She has never had anything like this before.
Yeah. Thank you so much for detailing in your own word. And now I need some more relevant details and information regarding her general health. And so, could you please tell me though recently she is does she have any recently illness, any hospitalization, or she is taking any type of medication prior?
Yeah, my daughter's general health is very excellent. She hasn't
Wow,
been
yeah,
ill
great.
recently and she isn't taking any medication.
Okay. And have you remember that in your family, in her family, have any history of asthma, hay fever, or eczema?
Yeah, my spouse has had asthma as a child, but I don't think anyone else in the family has had asthma, eczema, or hay fever.
That's great. And thank you so much for sharing me again the relevant details. So I am glad to share with you that the result of evaluation that Elizabeth vital signs are the normal in the range, and that indicate the condition, that indicate that she is stable now, and there is nothing to be alarming sign. So please make yourself calm and easy. And it is true that mild wheeze is presented, but it may be caused by the other things that including some minor cold and cough. So there is nothing to be worried. Please make your calm and relax. And I would like to tell you something that very beneficial to your daughter. First of all, doctor will again do the assessment, thorough assessment. Then he will, if they required, if they required, then they will be recommended some further investigation or test, and there will be also one person to make a initial diagnose. Then later on, all the outcomes or treatment plan, further investigation, and all the things will be discussed with you. How does this sound?
That's very nice, nurse. But I just
Okay.
want to know if my daughter has asthma or not. I don't want all these things which you are telling. I'm pretty sure my daughter has asthma because of her
Yeah.
symptoms and because my spouse had it as a child.
Yeah, I can sense your emotions, but I'm so sorry to say you, I'm not an authorized person to build up any kind of diagnose. Yeah, it is true that the symptom consists with the asthma, but sometimes it is very difficult to diagnose at the minor age groups. So please do not. Please wait the doctor to make the diagnose firstly, and I requested you to refraining yourself to form any type of self-diagnose. So are you getting my point?
Yeah, of course, nurse. I'm able to understand what you're telling. And yeah, I really hope I don't need to wait too long for my daughter to see the
Yeah,
doctor.
okay.
Make it soon,
Yeah,
nurse.
yeah, I totally understand your concern. Being a mother, a 3-year-old situation, but it's time to work, not to lose hope. And I requested to being a strong woman, because you are only one woman, you are only a one person to take care of your child. So, and in addition, yeah, they in this department there are the lots of physicians are available, and this department is not so busy right now, so doctor will come soon or shortly, and with the quick or thorough examination of your daughter by the doctor. After that they will be starting or commencing the treatment. I mean to say, commencing the advanced level or high level treatment plan, that including salbutamol inhaler. So, are you comfortable for this?
Yes, of course, nurse. That's very clear. And what
Yeah,
am I supposed to do now till the doctor comes?
yeah, that's good. That's good question. So, please, I will request it you to please wait in the waiting room. We will call you in shortly whenever we doctor will come. So, I hope I am clear everything in detailing.
So that's fine. I'll go back to the waiting room and wait for
Yeah,
my daughter to be called to see the doctor. Thank you very
yeah.
much, nurse, for your
Thank you
patience
so
and
much.
kindness.
Thank you so much. And finally, let me thank you. And still, you have any concern? You you do not hesitate to ask me. So thank you so much.
Yeah, that's very nice talking to you.
Thank you so.
Yeah. Now, coming to the point, let us start with the feedback. Yeah, you are doing well, no doubt regarding that. And then you have improved a lot. Earlier, you're not able to speak sentences properly. You are struggling, but now words are coming, word after word, line after line, sentence after sentence. You are speaking many different things. If you practice like this every day, 1 or 2 speaking sessions, at the end of 15 days or 2 weeks, then you can definitely see your progress drastically. Okay. Now let us talk about the mistakes you have made. There is nothing to be worried. There is nothing to worry, or there is
Okay.
nothing to be worried. To
Yeah,
be
worried.
worried, passive voice.
Okay,
There
sir.
is nothing to worry, active voice. There is nothing to be worried, passive voice. So use either that or this. And then you
Mm.
said, sorry to say you. Sorry to say you. It's a sorry to tell you, or sorry to say.
Okay.
Then no need you. Sorry to tell you. That's what you have to
Okay,
say.
sir.
Then please wait the doctor. Please wait for the doctor. Please wait for the doctor. Then you said, we will call you in shortly. We will call you in shortly. That's fine. So we'll call you inside. That's the meaning. Shortly. That's very good. But otherwise, it's a mistake. We'll call you shortly. That's enough. Okay. We'll call
Okay,
you
sir.
in shortly. That's also fine. no problem with this sentence because it makes a proper sense here. Even if you add it in, makes proper sense. Right. Then next one, the flow of speech, your fluency is okay, is improving gradually. And the rhythm, everything is going on in track and then on track. The next one is your grammar. Yeah, grammar, there is some problem. We are going to rectify this problem on a gradual basis. You learn a lot of sentences, but when grammar parts, grammar concerns are there, we are going to get through your, we are going to get your speaking sessions typed already. They are typing and they are editing the material. And then once it is ready, we'll be sending it to you. And then afterwards, we'll get the complete feedback. So no need to worry. Grammar, everything you'll be learning. Sentence after sentence, you'll be getting them. So that's not a problem at all. Then vocabulary. Because you are, not that free. You are just a little tensed, worried and upset and anxious. Because of that one, you are not able to focus on the vocabulary. You're speaking whatever is coming to your mouth, you're speaking. So you can wait and think and use better vocabulary. For example, you are telling again and again. So there's a lot of repetition. The word repetition is important. Okay. Then avoiding is normal word. Refraining from or abstaining from. These are special words. You can use these words. Vocabulary also you can enhance. Then pronunciation. Practice more, and you will definitely get the difference. Then again, fluency we have discussed. Then accuracy. Accuracy, we have to focus more on these, all these things. Then automatically your accuracy will increase. Then every day you do these sessions. What all the suggestions are given, you try to implement. For example, I'm going to give you some sentences for this speaking role play card. Let me give you some sentences. Yeah. Would you please provide me some basic information regarding the child's symptoms? For instance, the duration of the problem or symptoms. What was it that triggered you possibly? What are the possible triggers you think? What are the changes in severity? What treatment did you give her? And did she have this problem before? Did she face this situation before anytime earlier in life?
Yes,
so if you provide all this information, that would be definitely helpful to me, so that I can understand your condition and discuss with the doctor or present to the doctor when he comes. I'll make a note of all your points and I'll discuss with the doctor, and you can talk to him. It would be better. So
yes, sir.
Next one, you can also say like this. All right. I cannot diagnose your condition because I am not the authority over the subject. I'm just a nurse. I'm not a doctor. So if you really want a definite diagnosis, a perfect diagnosis, then it is better for you to wait until the doctor arrives, because he is the person who is vested with the authority. He has all the knowledge regarding everything. So when he comes, he will diagnose the condition. He will give you the prescription also to overcome this problem. So it's better you can wait for 15 to 20 minutes. Once the doctor is here, then I'll call you and you can discuss with the doctor. You can share all your problems freely without any hesitation. And once you are done with, then the doctor will analyze your condition. He may have an examination, physical examination of the child. In addition to that, he may ask for some laboratory tests. He can order he may order some laboratory tests, and based on this physical examination and the laboratory test reports, he may come with a final decision and diagnose the condition of the patient, or diagnose the condition of your daughter, and afterwards provide the necessary prescription. So this is the way how you can talk. Right, no need to wait. You can just sit. There are a number of doctors here. This is not a one-man show. There are 5 or 6 doctors on board today. If not one, the other. There maybe it will take in a matter of 10 minutes maximum. So no need to worry. So it will be a quick examination. Okay, it will not take much time. Then afterwards, all the other things will be treatment with a salbutamol inhaler or whatever it is. The doctor will give the prescription and he will suggest you. Okay, so can you please go to the waiting room and wait until you are called for. And really, I appreciate your cooperation. So come out of your panic or worry or tension. Okay, being a mother, you are worried about your daughter. I understand. I totally agree with your concerns, but we cannot do anything right now. The condition is stable, so you can just relax, rest assured, everything is fine. So once the doctor arrives, you will be called. I will come and call you so that you can discuss with the doctor. This is how you can speak. Now you have 1 minute. In this 1 minute, you can share all your experience, how your improvement is going on. Did you see any difference from the previous session till now? How you notice the improvement? What are the improvement areas that you have noticed? And what are the other areas you need improvement? All these things we can discuss.
Yeah, first of all, thank you, sir, for making me in this level. And I am improving my level of fluency because I have very humbling person to speak in English. So there is lots of I know that there is lots of mistake I have do, but yeah, I am in a learning period, so it's allowed to doing mistake. So, but I am definitely sure to erase my mistakes as early as possible. Thank you so much, sir.
Yeah, that's very nice. Keep on working hard and improve your quality. Yeah, that's all, guys, for today's session. Here we are with Kiran Kaur from Delhi, and the session is done with. And then we are going to have the next session, that is of Sangeeta Egambaram, the principal of a nursing college, Bangalore. And we are getting to that. But before closing the session, let me tell you, if anybody is interested to attend our sessions, contact me on +91 98 67360. I repeat, +91 98 67360. You can contact me and you can subscribe for the courses. Thank you, one and all. Have a nice day. See you again in the next session.